I'm Dr. Mitra Motamedi, a practicing family physician with a special interest in mental health and ADHD. And today I'm going to review ADHD symptoms. We still don't have any blood work or imaging to confirm the ADHD diagnosis. So we still rely on DSM-5 criteria. These criteria were designed to standardize the diagnostic approach and research projects for mental health conditions, mental health disorders. Based on these criteria, there are three types for ADHD. One is inattentive type, one is hyperactive and impulsivity, and the other one is a combined type, means combination of both. So each of these types have 9 specific symptoms that we need to have at least 5 out of those 9 positive. In children, that we need to have 6 positive symptoms, and in adults, 5 symptoms positive is enough. So there are 2 very important features that are missing in DSM-5 criteria. One is executive dysfunction, and the other one is emotional dysregulation. ADHD is considered a neurodevelopmental disorder, and it means symptoms are present since childhood. So based on these criteria, we need to have the symptoms present before age 12. And the symptoms must be present in 3 different, at least 2 of the 3 different settings: the school, work, and home. Based on DSM-5 criteria, we are missing people who are able to hyper-focus on what they are interested in. So if one can hyper-focus, doesn't mean that they don't have ADD. ADD means attention deficit disorder. So there's no deficiency in everybody. But for the most part, the problem is inability to keep their attention and focus on what they are doing. So there are 9 symptoms, as I said, under this category. One of them is inability to keep attention, as I said. So they are sitting in a long, maybe boring, not very interesting talk like mine, and they, in order to keep themselves engaged in that talk, what they do is like they may sit at the very front and take notes like all the time, or in more like severe cases, at the same time that they are listening to this to the lecturer, they also have to do something with their hand. They have to like play with tap their pen, or play with their beard, or sometimes they just knit. They do something in addition to listening to the talk. It's difficult. It's very difficult for them to keep their attention. They may have to record the talk and listen to that later on. So they have some difficulty. So there it comes also listening to others. So here I want to talk to partners or friends of people with ADHD. They do want to listen to you. They are trying their best to keep their attention and listen to you. But it's out of their control. It's again depends on external or internal distractions. They can easily get distracted. With the smallest sound or movement around, they get distracted. So the third symptom is making careless mistakes and missing details. One can say, well, all of us make mistakes, all of us may miss details. But in people with ADHD, this is more significant. They have to spend more time. They have to put more effort in not making mistakes. So if we rely on the questionnaire only, I see that a lot, that some adults check mark, no, I never miss details, I never make mistakes, or rarely make mistakes. But when I interview with them, and this is emphasizing the importance of addition of interview to the questionnaire and not relying on questionnaires alone. So when I'm talking to them, I'm asking them, how many times do you check your work? Like they check multiple times, not just one or two. They feel worried. They are worried, what if I make mistake? And that's why they carry this worry all the time that they are at work. At the end of the day, they feel exhausted. So it's more significant than people who are neurotypical. Symptom number 4 is inability to finish a job. So they struggle to finish a task. It can be a career, it can be a job, it can be a simple tasks at home. So they start a job, they get bored, and then they quit and look for another job, or they cannot make this. They have difficulty making decisions, so they may change careers, or they are working at home trying to do their house chores, and they do multiple things at the same time. They are distracted all the time. At the end, they will finish it, but it's not very efficient. It's not an efficient way of working. So they do struggle. Another big one is avoiding or procrastinating the tasks that they are not interested in. There are so many things that we need to do regardless, like doing taxes. So these people, when they are not interested, it's out of their control. They want to, they know the importance, but they just can't. They can't make themselves sit down and work on what they are not interested in. It's very, very difficult. A lot of pressure, a lot of effort needs for these people to get things done on time. So when I ask them in my interview, most of them, they say, well, when you have, let's say, 1 month deadline to do this work, most of them start the work at the beginning, and then they think they have a lot of time, so they don't need to, they just leave things. And then only at the end, when they're closer to the deadlines, then they will have an adrenaline rush, and then they get anxious, and they cram all the work on the last minute, last days. Sometimes, most of the times, they are able to finish the things, but of course with lots of errors because of the rush. Sometimes they have delays and they are late in submitting their work or doing their tasks or doing their taxes. Difficulty organizing is another one. So when they are a child, they have difficulty organizing their bags and binders and folders and lockers. Everything is a mess. Their bedroom is a mess. And when they are adult, they still have difficulty organizing their room, their closets. Again, they have to put a lot of effort, or only when they can't function anymore, they hate it, so they spend whole day to clean up and tidy up and organize things as much as they can. There are people with ADHD who also have OCD, like OCD, anxiety as a concurrent disorder. We don't see these problems in people who also have this OCD type of obsessiveness and compulsion. They want to have their spot to be clean and neat, otherwise they can't sleep, they can't function. So we don't see this type of symptoms in people who have ADHD plus OCD, or people who have concurrent anxiety disorder. I see that a lot. People who are perfectionists. I see that more in women, also in men. They do their best to not miss anything, to not lose anything, to have things organized. the amount of effort that they put in is way more significant than a neurotypical, and they get anxious. The thing that differentiate these people from ADHD people with no anxiety disorder is that their anxiety and worries and fears of things is the main driver for them to not lose things, not miss things, not everything, because they are afraid, they're worried all the time. And this is again another reason why some of the questionnaires come back negative. So you ask, do you miss things? Do you lose things? Are you late? They aren't, because of their anxiety. So in these people, we may underdiagnose. We need to dig in a little bit more and ask more. How much effort you put in? How many times do you check things? How much anxiety you feel when you're thinking about all of these things? They feel exhausted. Another big one is forgetfulness. Like my assistant here, who is recording me forgetting his stuff, bringing with him. I'm just kidding. So yeah, they in severe cases they may enter to a room forgetting why they are there. With forgetfulness, yes, all of us, we need to have reminders. We use our calendars. We need to have this, otherwise we will forget. It's normal. But a person with ADHD needs more number of reminders. Multiple reminders, different types, on paper, on computer, on laptop, and everywhere. And they are very prone to easily forget things compared to people who are neurotypical. The interesting thing is that we see the inattentive type more in girls than boys. And this is where this myth is coming from. We think that ADHD is a boy who is bouncing off the walls. And that's how we are missing the diagnosis in children who are just inattentive, mostly more in girls. I haven't really seen anyone who has pure hyperactivity and impulsivity with perfect attention and focus and able to prioritize things, able to organize things, no problem in executive function or anything, and just hyperactive. I have some difficulty convincing myself that they have ADHD, so I would skip this part, but I want to discuss the symptoms, those 9 symptoms that you see in people with hyperactivity, impulsivity. The importance comes when we are diagnosing combined type of ADHD. With those people, we should have like 5 symptoms of inattentiveness and 5 symptoms of hyperactivity, impulsivity. So what are the symptoms of hyperactivity and impulsivity? Number 1, and one of the most common symptoms is fidgeting all the time. They can't help, they are shaking their legs all the time, they are tapping their pens, they just can't sit still, they are fidgeting all the time. Other one is running about, being on the go. So again, interesting thing is that children, like imagine a boy who is running around all the time. It's like abnormally running around all the time, not normal. When they grow up, they change. This hyperactivity, physical hyperactivity, changes to impulsivity, changes to inner restlessness, and they still can't sit still. This comes in different severity though. So in more severe cases, they may skip the classes, they may avoid as much as possible sitting in long meetings or lectures. In milder cases, like inattentive people, they can sit there, but it's just their mind is wandering and they can't keep their attention. So fidgeting all the time, running about, being on the go, restlessness, not being able to keep seated in a place, these are some of the symptoms of hyperactivity, impulsivity. They are not able to engage in activities quietly, like mostly in children. And in adults, again, they are impatient. They are like too impatient. They just interject your talks. They have difficulty waiting their turn, and they can't help. They interrupt other people. There were two other features that, as I said, are missing in DSM-5 criteria. One of them is executive function. So these people may or may not have problem with planning, with prioritizing, with management. They may have time blindness. They are not able to estimate the time or budgeting. Whatever they earn, they can't have saving. They learn coping strategies over time to use to help with this dysfunction. In severe cases, they always keep having problems. Another very important feature is emotional dysregulation. Not everybody has this problem, but when they do, they can have significant mood swings. The mood swings can be very happy, very high, going down to very sad or very angry, very irritable in a day with the smallest things. They may take things personal more than others. So ADHD symptoms are more pronounced in childhood. And children, most of them carry these symptoms into their adulthoods, up to 65% of them or maybe more. I am seeing patients from 6 to 76. And in my experience, these symptoms change over time. So the symptoms of a child is different from an adult. The intensity of these symptoms change too. It all depends on some external factors, some internal factors. External factors, as an example, is changing jobs or a period of life that there are lots of pressure or stress, or like COVID pandemic that changed all lifestyle, all the work style. These are some examples for external factors that can intensify the symptoms. There are internal factors. For instance, hormones. Like women can have more significant symptoms before their periods or during their menopause time. Children, as they grow, they learn coping strategies. They learn the consequences of not paying their bills on time or losing their keys. And they learn how to put their keys in certain area, certain spot. What makes diagnosis challenging is the difference of presentation of ADD, ADHD in children, in adults, in girls versus in boys, and the difference in intensity of the symptoms in different times of their lifetime, and also like presence of other comorbidities like anxiety disorder and OCD. All of these would make the diagnosis more challenging, and this is why we don't rely on questionnaires only. We have to have interview, we have to have clinical interview with these people in order to understand their struggles and in order to come up with a diagnosis in a better way. In my future video, I will talk about how we diagnose ADHD. Be with me.